Hi, my name is Cameron. I'm a health volunteer here in Rwanda, and here we are at our Ijikoni, our kitchen. It's the result of a health project that I've been working on with my counterparts, community health workers, and other community members to improve the kitchen facility here at our health center in order to make it a place that we can both prepare meals for children, especially those suffering from malnutrition, but also work with mothers, caregivers, and community health workers to teach about how to prepare a well-balanced diet. So here we are inside of our kitchen, and one thing that we installed was this sink. It can be used both to wash dishes and food before we prepare it, but also as a hand washing station so that people can clean their hands before they cook or before they eat, because having good hygiene is an important part about preventing malnutrition in children. One other addition in our kitchen was this cabinet. It's a place where we store both kitchen utensils and plates and different dishes, but also food before it's prepared so that it's off the ground in a more hygienic place. We also installed improved stoves. So these are stoves that can be used both with charcoal and with firewood, which are two of the main cooking methods here in Rwanda. And one other addition to the stoves was this chimney so that the kitchen itself is less smoky and a healthier place to prepare food. So here outside the kitchen you can see that we installed tile and some benches to make it both a clean and comfortable place for mothers and other caregivers to sit while we're doing cooking demonstration, lessons, or enjoying some food. So thank you for looking around our kitchen, our Ijikoni, with us. This project definitely could not have been as successful if it weren't for the collaboration with my counterparts, community health workers, and other members of the community. We really hope that this space helps to improve the nutrition of the children in our area. So thanks for visiting.